As part of our centennial celebration, we remember the Miriam's humble beginnings as we look forward to the next century of high-quality healthcare. 1902. Mary Newman Grant leads a Jewish women's group to raise money for the establishment of the Miriam Hospital. 1907. The group becomes the Miriam Hospital Association of Providence, Rhode Island, and continues efforts to establish a hospital. 1914. Pushkis, Yiddish for collection boxes, are distributed to thousands of Jewish households to collect coins to help the poor and the sick. 1924. An appeal for donations is published in a fundraising circular by Max Grant, Mary Grant's son, who becomes the hospital's first president. 1925. On November 15th, Miriam Hospital dedicates a newly renovated building at 31 Parade Street in Providence. The hospital's first patients are seen on the next day. The main hospital has 63 beds with private rooms, boasting a home-like atmosphere, and a nursery with 14 bassinets. The hospital also includes a modern operating suite and 2 kosher kitchens. 1926. On March 25th, the Miriam is officially chartered by an act of the Rhode Island Legislature. 1932. In a landmark operation, surgeons successfully remove a 10-year-old girl's lung, the first surgery of its kind in the country. 1945. During the campaign to build a new hospital, there is overcrowding at the Parade Street location. The former Jewish orphanage at Summit Avenue and 5th Street is purchased by the Miriam and is adjacent to the new building site. 1953. On January 5th, the new hospital opens and 27 patients are seen on the first day. It has 150 beds with capacity to manage up to 210 if needed, and an obstetrics department with 30 bassinets. 1962. Ground is broken for the first addition to the hospital, which adds more than 100 beds, new operating rooms, and a 20-bed ICU. 1973. Dr. Robert W. Hopkins successfully performs the first kidney transplantation in Rhode Island on a 17-year-old high school student from Central Falls. 1983. The hospital purchases the Summit Avenue School. The site later becomes the home of the Norman and Rosalie Fain Health Centers. 1994. With approval from federal and state regulators and its boards of trustees, Lifespan, the holding company formed by the Miriam and Rhode Island hospitals, becomes official. 1998. The Miriam is the first hospital in New England to receive Magnet certification for nursing excellence from the American Association of Nurses. 2006. The Miriam is Rhode Island's first hospital to offer robotic-assisted urologic surgery with the minimally invasive Da Vinci robotic surgical system. 2007. The Victor and Gussie Baxt building is added to the hospital, adding 36 private patient rooms, 10 operating rooms, a radiology suite, and new locations for the gift shop and cafeteria. 2020. As the COVID pandemic sweeps across the globe, the Miriam Hospital treats the first Rhode Island patient and later opens a clinic for patients with long COVID. 2024. Exciting changes are ahead when Lifespan rebrands to become Brown University Health. It's a major step to raising its national profile and improving the health of a broader population. 2025. The Miriam Hospital breaks ground on a $125 million construction project to renovate the main building and enhance patient care. With shovels in the ground and a new building on the horizon, the Miriam Hospital launches its next century of healing, health, and hope.